Welcome along to this deep dive. Today we're really getting into something fundamental for the OET Listening Part A, and that's understanding question types.
Absolutely. It might sound basic, but knowing these types, it's honestly a huge time saver on the test.
Yeah, and it boosts accuracy too, right? Because you know what to listen for.
Exactly. Think of it like the test giving you a heads up. The question type signals what specific piece of information you need to grab from that audio conversation. It's all about being efficient.
Okay, so when we say question type here, what exactly are we talking about? Is it just the topic?
Not quite just the topic, it's more the kind of information the question wants. So in listening part A, you'll mostly find questions asking about, say, the patient's symptoms, or maybe how long something's been going on.
The timeline or duration.
Right, exactly. Or it could be about the treatment given, or perhaps the advice the professional offered. Those are the big three.
Got it. So recognizing the type helps predict the sort of answer we're hunting for in the dialogue.
Precisely. And the wording of the question itself, that's your first major clue. It tells you what's likely coming up.
Okay, let's break that down. First up, those symptom or complaint questions. How do we nail those?
Right. These are pretty straightforward. They simply want to know what the patient said was wrong, what they reported.
Uh-huh.
So take an example like, what symptom did the patient report first? The really crucial step here is finding the key words.
And for that question, the keywords would be?
Well, definitely symptom and report. But the really key one there is first.
Ah, the order matters.
Hugely. Underlining those words tells your brain, okay, listen for symptoms, specifically the first one mentioned. It's easy to hear maybe 2 or 3 symptoms, but if you miss that first instruction, you might pick the wrong answer.
That makes total sense. Precision is key. Okay, what's the next common type we should look out for?
That would be questions about time and duration. So anything asking when something happened or how long it lasted.
Like, how long has the patient had the pain? That kind of thing.
Exactly like that. For that one, your keywords are clearly how long and pain.
Right.
That phrase, how long, is your trigger. It immediately tells you the answer is going to be a time period, so you listen for things like,
Sure. For 2 weeks or since Monday.
yes, or specific dates sometimes. Just be a little careful, because the patient or doctor might mention different times for different things. You've got to match the time to what the question asks about, in that example, the pain.
Got it. Focus on the time phrases linked to the keyword. Okay, what about the third main type? When it's about recommendations or actions.
Yeah, those fall into the treatment or advice category. These questions are looking for what the healthcare professionals suggested or what steps were decided on.
An example might be,
Something like, what advice did the nurse give?
okay, and the keywords to underline there.
Advice, obviously, and nurse. These answers often pop up towards the end of the consultation.
Ah, good tip.
Yeah, so pay extra attention as the conversation wraps up when they're usually discussing instructions, next steps, that sort of thing.
This is really useful. It feels like a more strategic way to listen. Do you have like one overall pro tip to make this stick?
Definitely. Always underline the main question word. You know, the what, how long, when, whoa, why.
The actual question word itself.
Yes, that word is the absolute target. It tells you the kind of answer you need. Your job is to find the information in the audio that directly answers that specific question word. Don't guess, don't assume, match it directly.
Okay, great tip. So just to quickly recap for everyone listening, for OET Listening Part A, we're mainly looking out for symptom questions, time or duration questions, and advice or treatment questions.
That's the core of it.
And knowing which type you're dealing with before you listen really helps you focus your attention, doesn't it?
It really does. It acts like a filter. You can tune out the noise a bit and zero in on the specific details you need for that gap fill. Practicing this consciously, identifying the types as you go through practice tests, that's what builds speed and confidence.
Fantastic. This has been a really focused look at mastering those question types. So for all of you preparing for the OET, the challenge now is to actively use this. Next time you do a listening part A practice.
Try identifying the type first.
Exactly. See how spotting the question type beforehand changes how you listen and hopefully how accurately you answer. It's a small shift in approach, but it can make a real difference. And of course, we'll be back with more deep dives, maybe looking into parts B and C down the line.
Looking forward to it.